Welcome to Healthcare Algorhythm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Hey everybody, welcome back. You are on the Healthcare Algorithm, and today I'm joined by Dr. Tammy Pendhollow. She is a board-certified anesthesiologist and pain medicine specialist, as well as the CEO and medical director for Precision Regenerative Medicine. And today we're going to explore exactly what that field is about and hear about the latest and greatest technology that's helping people heal faster and more completely. Dr. Pendhollow, thank you so much for joining me.
Thank you so much. It's an honor to be on. I'm looking forward to in educating your audience.
Well, that's great because I think we need education around this concept of regenerative medicine. I don't think it's something that resonates with everyone out there. It sounds very futuristic in a way, but tell me your definition of regenerative medicine and specifically what led you to come and focus on it.
Absolutely. I'm going to limit this to the musculoskeletal realm as a pain management doctor, and I will put out there that we're not yet growing new cartilage, although that is the futuristic. We're not growing new discs that go inside between the levels of the vertebra and the spine. But we're talking about the ability of the body to heal itself, and that when put in the right environment, specifically, there is always the lifestyle stuff of sleep and excellent nutrition, anti-inflammatory eating, etc., that you can facilitate your body's own repair, not to the extent of growing a new knee or a new liver, but I will define regenerative medicine in the musculoskeletal space as harnessing the body's own cells from the blood in a product called platelet-rich plasma, or PRP, which many may have heard of, or in getting the stem cells out of your own fat or your own bone marrow. So there are applications of those in musculoskeletal situations, such as more advanced osteoarthritis of any of the joints or within the spine, although I don't use fat in the spine for reasons that are pretty much, it's just not safe. We can get some clots. Regenerative medicine is also a little bit of a wild west. There are some tech out there that is not using the body's own cells. So I will restrict my comments to your own cells, because right now the FDA says that anything that is not from your own body and is not put directly into area meaning it can the bone marrow, it can go into a joint, it can go into the spine, it can go from those things because it's very similar. But taking something like a umbilical cord or placenta, and culture expanding that and putting that back into these, that is not your own cell. So that is a drug by the FDA's definition. So I only talk about autologous or your own body cells.
Okay. And what got you into it?
I'll just say it. I was basically like a drug dealer saying I will trade you procedures for prescriptions for opioids. And my patients were not getting better. And we were only offering them destructive procedures like steroids. Steroids actually eat the cartilage. It destroys the joints and it accelerates osteoarthritis, believe it or not. Radiofrequency ablation to burn the nerves that go to the painful spinal segments. But by burning the nerves, you weaken the muscles, you destabilize the spine, and you make it more likely that a person's going to need to have a spinal fusion or somehow end up in an operating room.
So I knew trade temporary relief for long-term damage, more or less.
It is not long-term benefit for sure. Yeah. It was Band-Aids on bullet wounds, as I called it when I was in the Navy. So this is something that we're looking for, actually helping patients get better and partnering with them so that they can have control and agency and autonomy in their own health.
Was there a moment when you were first exposed to it and you said, wow, there might really be something here that's a paradigm shift, or you saw that opening to a new way of doing things that was more about healing than just temporizing? You have a story behind that, or how did you get there?
Sure. I first learned about it when I was in fellowship at Stanford in the 2011-2012 timeframe, and I started following it and going to conferences and learning about it. And it was one of those things where I said, this is what my practice will be in the future. But I had to go down that path of having my own practice or being with an ortho group where they were feeding me patients and I was doing the destructive things. And finally I said, I would rather just be an anesthesiologist than do this stuff. And at
Right.
that point, I went all in on learning everything, becoming very strong in musculoskeletal ultrasound and all of the tech that goes into this because it's not just a substitution of, oh, we used to put steroid, now let's put your blood.
Okay. All right. And so what is the patient experience like that? What is when they first hear about this, or if they're hearing, what is this regenerative medicine? Yeah, I'm getting steroids, it's not working. What is this? When if they're going to come to you for the first time and you're going to talk about this approach, how do you describe it to them in terms of the actual treatment itself?
I describe it as partnering together to help get their body ready to accept their own cells. And that means if they are inflammatory at all, based on blood markers, based on me talking with them about what their diet is, how their sleep habits are, what kind of exercise they're doing, that we want that to be neutralized before we pull their cells, whether that be blood, bone marrow, or fat. And then we precisely deliver it with ultrasound or fluoro guidance to the areas of injury and not just say it's my outside elbow from playing pickleball, but the elbow joint, look at the triceps around it, the everything, this whole kind of organ, the whole upper extremity or in the spine, everything that's surrounding it. And then we keep the body in a good anti-inflammatory period of it's going to take a couple months. This is not a one and done or a super quick band-aid fix like a steroid could potentially be. And we basically end up with a healthier human than when we even began because of the lifestyle improvements that they've had.
Okay, and I think people may have heard a lot about platelet-rich plasma or PRP as it relates to athletes. I think we typically think that's something but it's not just restricted to them, right? This is something that everyday weekend warriors or, even just folks out in the community have access to. Is that right?
Absolutely. I think we're all athletes. When we talk about the importance of muscle and the importance of movement in your overall health and decreasing the risk of, say, developing osteoporosis, falling or breaking a hip, and being one of 25% of patients who, after a hip fracture, dies within the first year. So it
Right.
really is important that everybody consider themselves an athlete in life and the importance of maintaining that muscle. And it's not just available to athletes. Obviously, Kobe Bryant and Tiger Woods and everybody made it really popular. But the patients I treat are ones that have a job and they can't not be on the job. They may even be sending money back home to people. So if they're not on the job, then they're not helping their family and extended family. So this is for everybody.
And so how did you get this into what is now precision regenerative medicine? Well, tell me a little bit about your journey to that.
Sure. I was developing all the skills and kind of getting the business plan together while I was still doing anesthesia. And then it was time to form the corporation and say, I am going to do pain medicine again, but it's going to be 100% regenerative. And that means no middlemen, no insurance, no anybody telling me what I can do. I'm not prescribing drugs. I am using the body as its own healing mechanism. So I started with a very lean and mean practice, and I still have a very mean and lean practice. So I rely a lot on tech and a lot on my own knowledge. And I, change the sheets and I answer the phone sometimes. It just is that way to be lean, but it allows me to also be nimble as things change. I'm on top of the latest and greatest with regard to the literature. We want
Mhm.
evidence based in this. We want to do things that we know are developing the best platelet rich plasma by how much blood you draw, what centrifuge speed, what kit you put it in so you can get the highest yield. So it's always about that. And I have been involved at the national level teaching other doctors how to do this and how to make that transition.
Now, did you find that patients were receptive to this new approach, or perhaps maybe people who were already looking for something different found you, or did you have to really spend a lot of time at the beginning explaining, "Hey, I know this is new. It's, not what you're used to, but let me show you the benefits," and really, like, prove it to them?
Yes, I think it's a little bit more of the latter. Whereas people may hear about it, but they're so used to the typical insurance model that they're a little taken aback when it's um, not going to be covered by insurance. Funnily, with over 200 publications in 2025 alone, and that means we have a database of thousands of publications, insurance will still consider this experimental,
Experimental, right?
although it has great evidence and is superior to corticosteroids and superior to these things. I can keep a person out of the operating room from getting a knee replacement surgery by putting bone marrow within the bones and PRP within the joints. And we've got 15-year outcomes data on that. So it is not experimental, but it is a mindset shift that says, wow, am I going to pay for the however much an iPhone costs, or am I going to pay for keeping myself out of the operating room and keeping me on the hiking trails and playing with my grandkids and kids?
And so I guess the way this works is you take the patient comes in, you identify that they're a good candidate for this therapy. You take their blood, and then it's a matter of getting their stem cells out and giving it back to them. Is that basically more or less the way
It
it
is
works?
a good overall. I will say that there are little to no stem cells in the blood. So if we're
Oh, I'm
talking
sorry. Okay.
stem cells specifically, that needs to come from the bone marrow or the adipose, but otherwise, absolutely correct.
Okay. And so, if you just think about the value chain of that, where is the majority of the cost? And the follow on is going to be, okay, are there opportunities to address that so that we can make this more available to people?
Absolutely. I would say that there is patient acquisition. I mean, this is a business, so there's the
Of
marketing,
course.
there's the funnels, the CRMs, all those things that go with running a business. It can be a very lean and mean practice, but there are literally hard costs with regard to the kits you use, the centrifuge, the needles, the sterile drapes, the sterile ultrasound probes, the ultrasound itself, a tech for fluoro. So there are these costs. And then there's the expert fee for being the one that
Sure.
knows who to draw the blood on, who to pump the brakes on drawing the blood on, and then how to take care of them, where to deliver the cells. So it doesn't have to be a very expensive proposition. And when you don't have middlemen where you're saying, well, insurance is going to pay me 2 cents on the dollar, so it really needs to be this much so we can get that much just to keep
Right.
the doors open, then it is actually a very value based care.
Yeah, I would imagine if you look at it as an investment in yourself, it really does have the opportunity to be cost effective. You just have to be willing to kind of stick with it. And I imagine the important thing, which is tough for a lot of people, especially when you're talking about precision type therapies or holistic type therapies, you have to do the other stuff, right? And maybe you can give a talk or give you a chance to, just to mention the importance of the other things that go right: sleep, movement, nutrition. How do you blend those into your practice?
It's a non-negotiable. I will say that you're not the right candidate if you're not willing to make these changes, because then we're not gonna get the kind of outcomes that you deserve or that you expect, and that gives the entire field a bad name. So I am a big proponent of and speak loudly on all social media about the importance of optimization of the patient and the importance of agency, autonomy. The person is my partner. We walk beside each other. I have expertise. I will make these recommendations, but I do nutritional analysis. I do lab analysis. We get the right imaging. We do a physical examination that is more thorough than they might have had even at their primary care doctor's physical exam. And we talk about the strategy, but I also use patient reported outcome measures, and we talk about what is going to be considered a success based on what I would expect, based on their age, sex, comorbidities, for example, diabetic or not diabetic, or
Mhm.
obese, not obese, and how we would expect them to get X percentage better by Y percentage time or Y number of time in months.
Yeah, and I have found in my career too is that one of the things that people often get into a rut with is that they feel like healthcare is something that is happening to them, not really for them. It's very difficult because it's hard for people to really be good healthcare consumers. There's a huge knowledge gap, and it's easy to throw in the towel and lose that agency. And
It
then
is.
once they do, then it becomes really difficult to stick with it. So I'm just curious, since this is something that's really important to you, have you found, any tools or even just what you've learned over your career that really helps keep people in present with that this isn't to them, this is for them and with them?
I think it starts with the first phone call and how I train anybody who answers the call, or if I'm the one that's taking the call, just to get to their why early and to let them know that this is a different way of looking at things. It's an hour-long consultation. We're having a conversation. I'm not talking at them, I'm talking with them. And then I use tech and I use data and I share that with them on a regular basis. So they're involved in that. And I give them options of, you know, do we want to stop at this level of prehabilitation? Are you actually getting better now that we've just stabilized your spine or strengthened your core? Or do you now want to go ahead and use your cells? Is this the right time in your life for that? And
Okay.
they've got this feedback. It's a two-way conversation and there are multiple check-in points. I mean, I say that we're going to be involved together for several months, if not half a year.
So what's the technology that you're using right now that's making a difference?
I would say there are a few different ones. One that is patient outcomes or patient reported outcomes measures and using those at a baseline at the time of the procedure and at set intervals after the procedure. And those are standardized across multiple cultures, multiple languages, and there's specifics for the joint, the cervical spine, the lumbar spine. The disability, the arm, hand, shoulders, anything on the upper extremity, special ones for the ankle, the knee, and the hip, and they can see it's a functional question like how much difficulty do you have going upstairs for a knee, twisting for a knee, getting on and off the toilet, putting on your socks and shoes. So if they can see that those measures have improved, then that helps them. And these are again validated and standardized using a database. And so there's tech where databases have been developed and they will say age, sex, the diagnosis, exactly how many cc's of blood were drawn, how was it spun, was it something that had white blood cells in it or not, how many cc's were put in each individual place, was guidance used, and then what kind of things did you do elsewise, like did you add in laser, did you add in shockwave, did you add in, I call it prehab with
Right.
the tech I'm going to talk about here. So we can then have this big, huge database of everybody across the United States that are saying, in general, when we have this grade of osteoarthritis of the knee and you're that age and that sex and it's delivered this way, we can say that as a group, about 80% of people get better in 6 months. So that's really empowering to the patient to go, okay, there's somebody like me that has undergone this before. So I think I can play this game. I think I'm good with that.
Are you finding that providers in your space are excited about participating in these kinds of databases?
I think they are because we
Yeah.
recognize that until then, we're going to have me doing something my way and you doing something your way. And 2 blocks down the street, nobody's even collecting data. So it helps legitimize the field. And it also helps us hone in on exactly what needs to be done so that we can get the kind of outcomes that patients want.
So how about when you go to the national conferences or the places where the stuff that's really emerging is getting in front of you? What excites you there? What in the next 3 to 5 years is going to be standard in your of care in what you're doing that maybe hardly anyone's doing right now?
I think what's gonna it might be 5 years, it may be a little bit longer than that with whole FDA, but I think the real excitement is coming in culture expanding your own cells, but that
Okay.
means you take your bone marrow on one day, you would come back about a month later, and in that month, those cells where there are few numbers of stem cells and have been culture expanded in a very sterile, very clean CGMP facility where it almost looks like, aliens with white hoods
Right.
and everything everywhere. So imagine that you would not want even a fungus to get replicated or a virus to get replicated. So then when you come back about a month later, you've got more stem cells to work with. You've got more likelihood because it is a dose response
Okay.
curve that you are going to get the kind of bang that you would expect from it. And so I think that that's what most excites me. But until that time, I am working on the pre optimization and saying, when I do this and I've got these technical skills that collect this way, my patients, because I send a sample off, have a cell count number that is this, that is well above what many of my peers are getting, but I attribute it to the prehab.
Okay. And do you even set it as almost a condition? Maybe in a empathetic way, but say, hey, listen, we have to get you prehab this far before I'll even consider injecting you.
Absolutely.
Yeah.
They deserve it. They
Good.
absolutely deserve it. And I've even had the time come where people have gotten so much better just by changing their eating and their sleeping that they're like, guess what? My knee doesn't hurt anymore. I know I still have advanced osteoarthritis. We didn't change anything on the x-ray, but it feels so much better. I'm good. I'll call you again if I should slip, if something should happen, but I am good, not even using my own cells at this point. Whereas others will say, I've got grade 2 osteoarthritis, which is a littler grade, and they're almost seen as
Hmm.
a prevention. PRP can be considered a disease modifying drug, a DMARD, which is saying maybe we can prevent it from even going on to stage 3 if you catch it early enough. So I've got those 2 schools.
So it sounds like this prehab concept is something that you're really bought in with and maybe even be a bit of a distinctive feature of your practice. I mean, are there tools out there that help you do it? Or are there tools out there if you could sit with a developer in a room and that could make that easier for you or force multiply you in that way?
Absolutely. I'll say a couple things that I do use right now.
Okay.
I use some tech that allows me to get 20,000 contractions, perfect supramaximal contractions of a muscle in a 30-minute session. And I do 4 of those as prehab to strengthen the core, to rebalance muscles. For example, most people have inside knee arthritis greater than outside knee arthritis. And when I look at their muscles, the inside quad muscles are weak, they're atrophied. And if we can preferentially build those above and beyond what any superhuman can do in the gym, then we can then take the load off that medial knee, that inside knee. So I use that kind of tech in my spine patient. This is a 1.5 Tesla magnet. So it's like an MRI technology, but
Wow.
it's
Okay.
proprietary. Similarly, there's a 1.5 Tesla magnet for the mind. And the mind body connection is a huge part for my spine patients. I've now said, look, we can't go forward until you've done this portion where we are now strengthening the mind in preparation for all of that. There's
So how
just
does that
something
work?
about spine. It is a repetitive TMS. So like transcranial magnetic stimulation, but not the 30 days of one day, 30 days in a row treatment, not the kind of shower cap with a whole bunch of the holes in it and a whole bunch of needles and painful and loud and knocking treatments. This is 6 treatments twice a week for 3 weeks that basically rebalances the dorsolateral prefrontal cortex, fancy word for basically where we say control emotions, able to kind of rebalance when we know our thoughts, we know our actions, and our emotions might just be kind of in this really funny realm on that left side, and it's underused compared to the right side, so it rebalances that, establishes the connection
I
into
have
the
to say
space.
I'm not at all familiar with this treatment or technology. And so this is generally used in mental health or
It was originally in mental health, absolutely, for severe depression, for example, that it
Hmm.
may be part instead of doing shock, um,
ECT, electroconvulsive therapy.
ECT therapy, but transcranial is more of an outpatient thing, but it's very labor intensive and it's like 30 days in a row for major depression. This we're working on outcomes for and indications for by the FDA. So it's FDA authorized for major depression, but we're finding
Right.
benefits in ADHD. We're finding benefits in
Wow.
anxiety, in binge eating, in all these other things that then can help when we're trying to harness the body's own cells and
And
heal.
tell me again, what's it called again?
Do you want the brand?
No, the therapy, just the name of
So
the therapy.
the therapy is a repetitive TMS or RTMS, and the
Okay.
brand is Exomind.
Exomite. Okay.
Yeah.
Interesting. Yeah. I'll have to look that up. I'm not familiar with it. But you find that you're able to use that in order to help prepare people to have a more optimal response or optimal donation, so to speak, of the cells for their PRP.
I do in particular for spine patients.
Fine.
I've got a
Okay.
lot of fibromyalgia patients. I've got a lot of women
Wow.
who are going through menopause that have that brain fog. And if I don't address this first, they're not going to respond. It doesn't matter that we've anti inflammatory them, they still have the that repetitive thing that's going on in their head that just we need to control alt delete their computer and
Wow.
then we can get even better outcomes. So I'm collecting the data, not just saying this, as anecdotal, but I'm collecting the data and I believe that ultimately that's going to be the thing that puts us back over the edge.
Well, we'll have to have you back then and see how that comes out. I'm learn about this because that's a new one. That's good. So listen, I always like to kind of end up with a couple things, and one is I like to think that healthcare is hard work, right? And you even gave a little bit of voice to it, is that you're not just an expert provider in these new therapies that many people don't have, but you're running a practice, and there must be what's the thing that when you wake up every day, yep, this is why I'm doing it, that really keeps you in it.
Being able to be in charge of my own destiny. I guess I'm an entrepreneur at heart. And even when I was active duty military, I mean, that's the ultimate of saying, yes, sir, yes, sir, yes, sir, and following
Absolutely.
the company line. But I just knew that I would be able to make the biggest impact when I was control of my schedule and how I would treat patients and be able to treat them exactly as they deserve to be treated. And that's not within the healthcare system or the health scare system or whatever you want to call it. So that's what keeps me going is knowing that I'm able to practice medicine the way that I believe that people deserve to be treated, and it fills my cup.
Well, that's great. And if you could reach that one person out there that really you believe would benefit this, but either doesn't know about it, doesn't know how to access it, or doesn't know what that first step is to take, what would you tell them?
I would tell them to decide what their why is, why they want to get better, why they want to seek treatment, whether that be to go on hikes, return to playing with their kids. There's this big vacation coming up in Europe and they can't walk the cobblestone streets, and then reach out. People can gain so much information, even if it's not that right time for them, or I'm not in their right city for them. There's still a big YouTube channel that is all about education, and that's free. And there, in my case, over 450 videos that are just telling them how to get better in terms of eating and sleeping and what vitamins and those things. There's so much education out there that just start empowering yourself. And from there, you can find somebody who is like minded and is on the same wavelength as someone like me, even if we're not in the same city or state.
But even if they're not, they can still learn from you because I believe you're accessible, right? So where can they find you and what you're teaching
My
about?
My YouTube channel is probably the most accessible. It's at Dr. Tammy Pendhollow. And the website also has a lot of information on how to choose the right regenerative medicine physician, questions to ask, etc. on both of those. So that's precisionmedprp.com.
Well, that's great. Thank you for teaching me something today. You know, they say you learn something new every day. This is not my wheelhouse generally, and I'm definitely going to look into that RTMS. And I do hope you'll stay in touch and let us know how your data collection is going, and again get the word out because I believe there's a lot of people who suffer with chronic pain and disability, and you cannot age well if you're not independent. And so I think you're serving a great cause here. Thank you so much for spending time and sharing this information with us today.
It was my pleasure. Thank you.
All right. And to everyone else, thank you for joining us. We'll see you next time on the Healthcare Algorithm. Until then, be well.